to know that probably not correct, but I will try my best. Our second speaker is Dr. Oluwasola Idowu from the Center for Integrated Health Program. He is a master from the computer science, and he basically serves as the hands-on programmer and the data analysis in that company. And his talk will about leveraging the community in treatment dashboard analytics to return persons living with HIV on ART care and treatment in Nigeria. Yeah, let us welcome Dr. Idowu. Now question. Please correct me. I really feel sorry if I cannot pronounce that. Okay, thank you.
Thank you so much. Oluwasola Idowu is my name. It's okay. It's okay.
I know that I cannot do that.
So good afternoon, everyone. I'm going to be presenting to you leveraging the continuity in treatment dashboard analytics to retain persons living with HIV on ART care and treatment in Nigeria. And I'm going to be using one of the most populous city in Nigeria with a population of close to about 20 million persons, which is Lagos State ART experience. So first, I'd like to acknowledge the co-contributors to this. I have a colleague of mine who presented yesterday to Obioma Zurungwa, who is the Strategic Information Officer. I have a Osal Mugun, who is currently absent, and Collins David Abimbola, and the Chief Executive Officer of Center for Integrated Health Program, Dr. Bola Ojiledun. So quickly, the background of the continuity in treatment dashboard. I would like to say first that this can as well be used interchangeably as the retention dashboard. Continuity in treatment is the same thing as retention, so you can refer to it as a retention dashboard. So in 2018, there were 1.8 million people living with HIV, with only 1.1 million, that's 64%, receiving antiretroviral therapy in Nigeria. According to the continuum of care demands, people living with HIV are identified, started, and retained on treatment using the unique 95-95-95 treatment code. In April 2019, through the US President's Emergency Plan for AIDS Relief, PEPFAR, CDC launched an 18-month ART search program in 9 Nigerian states, including Lagos, obviously, to rapidly increase the number of people living with HIV receiving antiretroviral therapy, with HIV prevalence in Lagos at 1.3%, and an estimated 120,000 people living with HIV, of which half are not on treatment. But of the remaining 50% who are on treatment, poor retention has been a concern for the search program in Lagos State. To this end, Center for Integrated Health Program, CIHP, with the funding of PEPFAR CDC, developed an innovative continuing treatment dashboard to monitor near real-time tracking of all people living with HIVs on treatment and prevent drop-offs, increasing viral load suppression, which minimize HIV transmission and thereby moving Nigeria to epidemic control. The project description, the evolution of CIT and routine. Now, this is a cascade of events. Before the innovation, it has always been a manual process of physically checking through patient folders and records, trying to identify those that are interrupted in treatment, those that are that are decreased in viral load suppression and all of that. But we moved away from that to the use of electronic medical records to generate data. Turnaround time for program planning accounts for poor detection of interruption in treatment. So a proxy for retention in June 2020, towards the end of the third quarter, the CIT, that is the retention dashboard, was developed and implemented, leveraging on Microsoft Power BI. I know there are some other analytic tools, Tableau, Google Analytics, but because of the popularity in our environment, and the seamless integration and simulation with the existing platform. For example, the organization leverages on Microsoft Outlook, so getting a lot from Microsoft analytic tool and pop-ups is very seamless. So we adopted the Microsoft Power BI to support near real-time analysis, reporting and deep dives of patient retention and treatment using data science method, obviously. So I'm just going to talk about the little of the data science methodologies we adopted. Data flow, that is where the data collection, the storage, and the accessing happens. Then the data curation, cleaning, modeling, and evaluation. So these are cascades of different events, but I'm just going to take through. Then data analytics, statistical analysis, data modeling, and simulation, data visualization, then expanding the data visualization, which I'm still going to show you, which happens to be part of the features of the retention dashboard, is the profiling, representation, and the GIS. So taking in a few minutes, I'm just going to take you through some of the features of the dashboard. So this is an analysis of the retention rates and losses analysis by facility, which is an overview of the facility level retention cascade, indicating the high and low performing facilities as it relates to the gain and losses. It simplifies monitoring of retention through visualization analytics. So looking at fine. So looking at the dashboard here now, this is basically the representation of what the retention looks like. So it's more like the breakdown of those that are retained, the percentage of clients currently retained on treatment. Then we want to know the losses. The losses goes beyond just those that are not showing up for treatment, transferred out, stopped treatments, and they are part of the losses. But however, we want to know those that missed appointments, those that are not showing up at the facility for drop pickup. That's why we have a disaggregation like that. So to know the high and low performing facilities, then this speaks to the high and performing facilities. On the other side is the RT rate by facility, and on this side is the retention rate, but we want to also see the losses. Then another part of the dashboard, there are like 9 pages of the dashboard with over 46 different charts, bar charts, analytics, speaking to program monitoring near real time. So basically, this is monitoring the viral load. So this is divided into two. The upper part speaks to the 1-year validity of the viral load, and because we have 4 quarters in a physical year, so we need to know those that are actually eligible for sample collection, viral sample collection in the current quarter. So the down part speaks to that aspect. So at this point, you can easily see the number of clients who are eligible but without a result, without viral results. Of those numbers who are bled, of the clients who are bled, how many results have we received? So the gauge, the chart is just telling us that bleeding coverage is at 95% as at the pool of this data. And of that 95%, we have 68.1% with results already. Then here, we also monitor. Now, the way the dashboard is designed is such that it is user-friendly and it is instrumental to the clinical procedures and activities at the facility level. If you look at the legends, you have the bled and not bled. So if you want to know those that are not bled, all you need to do is to click on that data point. Then you can see the underlying data. The underlying data are not aggregate numbers. They are patient level data. They are patient level data. You can actually see each of the patients speaking to this number. Then other implementations can happen, tracking, follow up to get the clients to show at the facility or get bled for viral collection. And as well, this is the drug appointment cascade. You want to know those that are scheduled for drug pickup at different points at different time of the quarter. Then this is drillable. You can as well drill down to know at what week, day a particular patient should show up at the facility for drug pickup. Then another important part of this dashboard is the potential interruption in treatment and interruption in treatment. We want to know the number of clients that are going to be lost at a particular point in time, so we need to monitor this. we need to monitor this. It is also disaggregated by age. Then this is just the patient per regimen, the number of clients on optimized regimen. So if there is a client that is on a particular regimen, then that may call for an investigation. Then this is the GIS. This is basically monitoring facilities at different local government area and the proximity of the clients to the facility. So this might be also some contributing factor to the reason why some clients are not showing up at the facility. So we want to know clients that are very close to the facility, living outside the local government area or living outside the state. So what are the lessons learned? Post retention dashboard implementation, there was a sharp decline. I'm going to show the graph briefly. There was a sharp decline of RIT rates, which is 2.6%, 49% reduction at some point. Then as well, we have the continuous decline since after the deployment. There has been a consistent decline in the RIT rates because of the fact that this is instrumental to the monitoring of the program. Then as well, it was useful for a near real time, I said it before, monitoring of the program. So this is what it looks like. At the point you have the 5.0, between 7.1 and 5.1 was the pilot stage, but when we had the full release, then the sharp decline came to 2.6. And this 2.6 is a whole lot because the numerator were changing, we were surging, so numbers were increasing. So just like I said, it means the retention problem we had initially has been solved. Clients are more retained, the patients are more retained, and you can see the continuous decline. So as of September 2022, the RIT rate was at 1.0%. Then also looking at the viral load coverage, you will see the point where we were before the deployment of the retention dashboard, and as at FY22 Q4, look at the situation. Now that sharp data point over there is as a result of delay in some of the viral load that also have been reported for that quarter. But the moment we resolved that, then everything, it just went up. In conclusion, the retention dashboard can serve as a critical tool to identify and follow up persons in care that are likely to experience interruption in treatment using predictive analysis to ensuring data. This has the potential to significantly improve retention among people living with HIV in care, then consequently improving clinical outcome. At this point, I would like to appreciate CDC, then our clients, which is the patients, and as well, I would like to appreciate University of South Carolina for the platform. Thank you so much. This is good.
Hi, taking the question. Any questions?
Hi, thank you for your excellent presentation.
Thank you, sir.
Coming from Bangladesh and trying to do something like this, I can really appreciate the work that you've done. My question is actually, so about the dropouts. We faced one of the problems like incarceration as one of the reasons. Do you have the reasons for dropouts in your dashboard? That's one question. And the second question is, other than the existing analysis that you already have in place, is there a way to do your own analysis within the dashboard by selecting different variables and trying to come up with new insights with clinicians can they do it by themselves?
Okay, yes. What we have done is to monitor the program with this. So it is 100% controlled by the state office. However, the EMR that we use has some embedded features where you can just pull, you can drag and drop, and you can drag and drop indicators, create pivot table for yourself, whatever you want to see as it relates to client's response to treatment. You can just pull that out on the EMR directly yourself. So that's what it is. Then concerning the dropout, yes, at some point you realize that I spoke about data cleaning because what the data that fits into this already clean data, with the exception of noise, dirt, and all of that, because data wrangling, data cleaning, there's another tool, we call that GIS, gap identification system analysis tool, that is being used at the end of every clinic visit and activities by the electronic data entry class. So what we are getting is very refined data already, and we have it streamlined such that it can speak to what exactly we want to see on the dashboard. I hope I've been able to respond to you. Thank you so much. Thank you, everyone.